This is the United Podcast Network.
This is Voices in Validation, brought to you by IVT Network. IVT Network is your expert source for life science regulatory knowledge. Voices in Validation brings you the best in validation and compliance topics. We interview industry experts from pharma, biotech, med devices, and laboratories. Here is the host of Voices in Validation, Stacey.
Thank you, and welcome to another episode of Voices in Validation, brought to you by the IVT Network. Each week, we bring you timely interviews with life science experts and discussions focused on trending topics, frequently asked questions, and industry best practices. This week, I am excited to bring you a panel discussion on life science industry challenges, opportunities, and next steps. And joining me today for that discussion is Valarie King-Bailey, John Lincoln, and Siegfried Schmitt. So welcome to the three of you. Thanks so much.
Thank you.
Thank you.
Thank you.
Yeah, this is going to be great. We're going to cover a few things going on and then get your thoughts on sort of the industry as a whole. So hopefully this will be very timely and informative for our listeners. To start us off, pharmaceutical research requires a huge investment of dollars and time. And lately, we have seen in the industry sort of stagnant growth. At the same time, consumer expectations are continuously rising. And some say we need to see a cure for a currently incurable disease or, like Alzheimer's or cancer or even COVID or something like that to kickstart things. Siegfried, I'm going to let you kick us off. Can you share your thoughts on that?
Thank you. Thank you, Stacey. Yes. So we see still a lot of research and development going on. And even in these diseases that are as yet incurable. And we see, for example, cell and gene therapies being developed. Now, although we see all this development still going on, there is another issue here, and that is someone has to pay for all these medicines in the end. And these don't come cheap. And especially under the current circumstances, the budgets of the healthcare providers are really strained. And they're not just because of the COVID pandemic, they generally have to make decisions where and how to spend their money. So to find the right balance between having the right product and the right price for the patients is quite a difficult balance to find.
Sure. Valarie, your thoughts on that?
Yes, I'd like to associate my remarks with Siegfried, but I want to focus kind of on COVID now, since this is kind of the biggest issue. I believe strongly we need a national strategy to address this issue. When the United States has faced other pandemics and outbreaks, we really leveraged successfully, I might add, a cohesive plan to address them. Mm-hmm. I look at our response a bit in frustration that we don't have a national strategy. And here's what a national strategy really does for us. It really guides our preparedness and our responses to a pandemic such as COVID-19. And it helps to limit the domestic spread of a pandemic and mitigation of the disease and suffering, as we've seen in the thousands of Americans who have died. And it brings together the infrastructure to not only mitigate the impact to the economy, but to the functioning society as a whole. When you look at the huge investments, as you say, Stacey, that are required, these investments cannot be met with piecemeal approaches. In other words, letting every company do it. As we could see with the influx of capital into companies like Moderna, for example, that has really helped because the government has stepped up. I think this needs a more cohesive strategy. And if we have a cohesive plan, that should guide what I believe is our preparedness and response to the huge investments that are required by pharma.
Yeah, I would agree. Thank you for that comment. And certainly we are in the midst of it. And everyone is looking forward to some vaccine so we can move forward with this pandemic. And I think having a few companies really focusing in on that is going to yield a much quicker result than
absolutely.
And so, yeah, we need to gather together as a nation and start doing that in a lot of other areas of this pandemic. John, your thoughts on that topic?
My expertise is not that much in pharma, but I will comment on what has been already said by Siegfried and Valarie regarding what is going on right now. One thing I see that is troubling is because there is a lack of cohesiveness worldwide, there's a bidding against one another. We see that with states bidding against one another. We see that with countries bidding against one another. We see that with countries trying to tie up commitments with certain companies that are involved in the vaccine manufacturing and development and manufacturing and trials. We see the pitting against wealthier countries and the poorer countries, especially in Southeast Asia and India and Africa. And all these issues, in the short term, they may be beneficial to companies and stakeholders, but in the long term, they're going to be counterproductive, at least from what I see. I also see some troubling trends in areas like antibiotics. This COVID thing is bringing up some issues regarding the fact that companies that were leading edge a few years ago, the darlings of Wall Street in antibiotics, are going bankrupt. And yet we sorely need antibiotics. The antibiotics are being compromised by overuse and a short lifespan. So what we're seeing going on in various parts of the world is a lack of cohesiveness, as other participants have already mentioned in our panel, and also the fact that
John, I think we lost you there for a moment. But it sounds like the three of you are all sort of pointing in the direction of a more cohesive plan, not just across the US, but globally. And it also seems to me that based on the three of your comments that we definitely do need to continue to innovate and bring about new drugs, whether they are antibiotics or vaccines, or cures for some of today's very concerning diseases like cancer. So I appreciate your thoughts on that. We're going to move on to the next topic, which is technology, basically. Artificial intelligence, continuous manufacturing, personalized medicine. They're all terms that we've been hearing for years. We're familiar with them in the industry. Yet it seems that we still haven't reached a point where we are truly leveraging these technologies consistently in pharma or in medical devices for that matter. Valarie, what do you think it will take to get us there?
Yeah, I think it's going to take a cohesive strategy and the will in these companies to really make that happen. So if you look at, what are the biggest contributors to the high cost of healthcare in the United States, it's really the complexity of the misaligned financial interests between payers of the service, providers, and patients. And so healthcare is really starting to use artificial intelligence, but not at the levels that we would expect to see. Really, artificial intelligence takes routine, mundane tasks and automates them. So for example, patient intake and things of that sort, where you're just routinely collecting the same information and that kind of thing.
Sure.
Artificial intelligence and machine learning can be used to identify the inefficiencies and really drive them out. And some of my clients are actually adopting this technology. So by embedding artificial intelligence into things like financial, clinical areas, and that kind of thing, you can eliminate these inefficiencies and remove some of the barriers to collaboration or more efficient collaboration and get a more practical, cost-effective approach. I think what it's going to take is for companies to, number one, embrace this technology and adopt it. Technology adoption tends to lag a little bit in life sciences, and it's going to take these companies really coming to the realization and looking at the cost efficiencies to really make this happen. It's going to take validation engineers the ability to be able to look at these systems and develop strategies for the validation of them. Validation regulations haven't really kept up with cloud technologies, artificial intelligence, and that kind of thing. So coupling the IT group with the business strategy groups, it's going to take these groups coming together, looking at inefficiencies, quantifying them, and figuring out how we can best move forward with this technology. That's what I think it's going to take.
Okay, thank you for that. Yeah, and I think even with big data, we hear about all of the data that we're collecting and analyzing it, using artificial intelligence machines is going to give us a much quicker analysis, and which obviously leads to a quicker result.
Indeed.
Yeah. Siegfried, your thoughts on that same topic?
Yeah, I look at it a little bit more from the global perspective, Stacey. And what I see is that there are a lot of small and medium-sized companies that are active in pharmaceuticals, and they simply don't have the cloud to apply these technologies yet. But that aside, even larger companies, they make very good money without optimizing their approaches, their processes, their systems. And as Valarie already said, there is an unbelievable lack of technology in the pharmaceutical industry.
Right.
There is a reluctance to apply it, and why that is so, it totally baffles me.
Do you think it's cost? Do you think it's because of the sheer cost of it, Siegfried?
No. I see lots and lots of facilities where the mobile phone in the pocket of the manager has more computing power than all the equipment they have in there. I'm serious.
Yeah, that's amazing. Given, the need as an industry to be on the cutting edge of, drug development. And John, I know you have a much more medical device background than pharma, and I would love for you to answer that question from that perspective in terms of bringing artificial intelligence and continuous manufacturing and personalized medicine into the device world. Like, what's it going to take to get that particular industry to, move forward more quickly?
I have to echo what Siegfried just mentioned regarding pharmaceuticals. In the device world, it's probably even slower than pharmaceuticals. The margins are not quite as great as they are in pharmaceuticals. Companies are comfortable kind of where they're at.
Right.
Try certain things, but there's less of a barrier to entry into the device field than there is in the pharmaceutical field. So you have a lot of startup companies, smaller companies trying to expand and become buyout targets. And as a result of that, they're more focused on the market, the stock market, and positioning themselves for a buyout than they are in getting high technology. That's not true of everybody, but it seems to be true with the companies I generally work with, which are smaller startup companies or mid-level companies. One of the big fields right now in devices is 3D printing, additive manufacturing. The FDA is really big on this. They published a guidance document recently on it. They have a panel that is devoted to developing the technology even in-house to see the issues regarding the nature of the materials used, the uniqueness of the materials, the supporting structures when they develop a 3D device, and the potential for customization of devices to patients, individual patients, based on CD scans, etc. So we see that, and we do see companies trying it a little bit. But what was interesting with this COVID situation, I was watching home-brewed people, teenagers even, using a hobby 3D printer to make masks, not masks, but the shields and things like that. Whereas I see the device companies really lagging in trying things like this, even where they're right now, they're a little bit hurting because COVID is taking up all the hospital's time and space, and elective surgeries are down and issues like that.
Right. No, and I agree. And there seems like there's tremendous opportunity there in that whole 3D printing world. But I mean, and so, you've all three of you have just mentioned the certain challenges and the slow moving industries, whether it's pharma and device. So do you think there is going to be something in the near future that's really going to drive home the need for the companies to pick up the pace a little bit and start to embrace these technologies? John, I'll let you continue.
Well, I definitely right now with COVID, it's hit two areas. I don't know, you might be discussing this a little later too, but two areas I feel have been really hammered by COVID. One is just-in-time manufacturing, the principles of just-in-time, especially when you have long-distance supply chains like between the U.S. and China.
Right.
And the other is not only just-in-time, but counterfeiting issues, issues along these lines where companies have to rethink exactly their whole approach, because not only COVID, but a couple of years ago, we saw the issue with the earthquake in Japan, and then the tsunami that wiped out the nuclear facility there and basically shut down the supply chain for the automotive industry, at least some of the key components for the automotive industry. These things are going to increase. Climate change is going to increase, the rising of the seas, the threat to cities that are on the coast for disruption of the supply chain. You're seeing talk right now of trying to bring back certain elements of the supply chain from overseas back into the United States to make them a little shorter in terms of time and a little less risky. But again, the COVID issue may also drive this issue that we were talking about earlier, robotics and AI, where companies will be looking at a non-human workforce, at least to some degree, to compensate for the fact that COVID is only one of the viral potentials that can come at any time. People have been talking for years that we're due for pandemics, and this is just one example of another one that could be right around the corner.
Sure.
Companies have to plan for that, although I don't see that kind of thinking with senior management right now.
Okay. Valarie, what's it going to be?
No, I completely agree with that. I think that companies have to improve their supply chain visibility to provide kind of line of sight capability to the constraints of their first, second, and third tier suppliers. I think that's really kind of lacking in a lot of areas right now. We don't have visibility. So, for example, we're still having hospitals complaining about not having enough PPE, and we're, not enough supplies for testing and things of that sort. And this is why, going back to the original question, that cohesive strategy needs to be in place. What we've done is we've kind of farmed it out to each of the states. I think we have to bring it back to really a national strategy. By going further into the supply chains, global manufacturers can get more of a complete picture of where things are coming from and where the deficiencies are, or the lack thereof. Regarding the artificial intelligence, again, I really like what John was saying in terms of using artificial intelligence and leveraging that in the future. I think that is going to be a critical component of our way forward. As we look at what we're doing right now, we're being told by governments to, at the federal and state level, to socially distance and that kind of thing.
Right.
I think this is where artificial intelligence and robotics, as John was saying, is going to come into play. It's going to be critically important in the future, and those forward-thinking companies who are looking at better ways to do this are going to embrace those technologies.
Right. And I think because of this pandemic, we have seen that we can, when we need to, pivot pretty quickly. Yes. In terms of people, working remotely in the large numbers that they are, the virtual audits that we see continuing to happen. So I think, unfortunately, it took something like this to show us that we can make this pivot when we need to. And Siegfried, I want to get your thoughts on that before we move on.
Yeah, so in short, I agree that, yes, it is possible to do more with automation. However, the industry isn't largely set up to do so. They would first have to implement it.
Right.
You don't have the robots. You still have humans filling in bags into reactors and assembling pens for injectors and so on. So we still have the human element there. Mm-hmm. From the supply perspective, if I may, as the editor of a book on good distribution practice, I always like to see in industry the best practices applied. But most companies that I've been to would not have a complete map of what of the supply routes for their goods. They know it may come from China, but they wouldn't know, does it come from this factory to which harbor, to which airport, which companies are in between before it even lands on your desk. And this black hole, this not knowing where things are coming from and where they're going to, doesn't make it easier. And supply chains are incredibly complex. And I think even if you bring it back into your country, you still have issues with supply chains.
I would agree. And sometimes it's not just the logistics. So that leads to the next question then. How do we bring innovation to the supply chain so that we are better able to manage it, saving money, time, and shortening the drug production cycle so that we can reach the patients faster? Because, I hear talk about COVID vaccines being created, yet even once one is approved or two are approved, it may take years before they're able to get them to everyone globally. So is there a way that we can innovate the supply chain to help this along, in a much more timely fashion? Siegfried, we'll stick with you for the moment.
Yes, I certainly think there is room for improvement. What we must, however, still have is to have evidence that whatever has been developed is safe for use with patients. So we cannot just say we apply whatever comes out of research as a COVID vaccine without testing it thoroughly in clinical trials. Yes. And these clinical trials will take time, and this will take years. This is one aspect. The other aspect is, of course, there's only so much production capability and capacity. And you can't just increase at will and wherever you want it. There's a good reason why there are these centers of excellence, so to speak, of certain production sites, be it, say, Singapore, be it in the US. It's not that easy.
Sure. Valarie?
Yeah, I think we need to, from the standpoint of looking at this holistically, I think business leaders need to look at how new tools and technologies can provide greater intelligence to the processes. For example, risk evaluation tools that make use of machine learnings can find patterns, if you will, that can indicate either risk or opportunities in either macroeconomic or geopolitical or global health perspective, and look at that in relation to other data. I think also company executives should look at expanding their use of landed cost tools to look at new elements like carbon offsets and things of that sort. These things can rapidly model alternate supply and transportation scenarios like rerouting around a port and that kind of thing. I think also companies need to focus on resilience. With all of the learnings that we have, we need to understand how resilient are we and get plans in place. Companies need to understand their supply chains in more than just one dimension. The COVID outbreak is likely to last well beyond anything that any of us is comfortable with. So I think we need to look at how we build resilience into our supply chain. Some of this is already underway, but I think we need to look at opportunities for improvement as we go along.
Absolutely. Thank you. And John, would you like to add anything to that?
Yes, the incentives really aren't there. That's the sad part about it. There's nothing to tell a CEO of a device company or a pharmaceutical company that he has a competitive advantage by being at the leading edge or bleeding edge of some of this activity, especially if they're profitable right now.
Yeah,
I find that inertia all too common, unfortunately. And most everybody, I do know exceptions at the C-level suite, but most everybody's focused on the quarterly financials, and they're driven by that as opposed to long-term holistic thinking like Valarie mentioned, which certainly is needed, but it doesn't exist, at least not to what I have observed with some of the people I've dealt with. And my client base is not that extensive, and it's like I mentioned earlier, it's more at the startup and the mid-level companies as opposed to the huge companies. But I've had some experience in the past with them, and sad to say, I've seen CEOs not even really focused on their own industry sometimes.
Which is unfortunate. Yeah.
Yes.
I think it's going to take a couple of big leaders to step up with a plan, right?
Yes.
And sort of and create a roadmap, so to speak, for these other companies to utilize and follow along. But until there's an incentive, it's hard to imagine that happening.
Yes, sad but true.
Right. So let's talk a little bit about some opportunities in the industry, because there are many, and we've touched on some in terms of talking about technologies. And Valarie, as the importance of big data grows, how do you see the industry making better use of it?
That's a real good question, because big data, especially in pharmaceuticals or life sciences abroad, can bring many benefits. I see companies using big data, number one, for greater intelligence as they're managing the various processes that they're going on, that they're implementing, whether it's talking about new drug development or new medical device development, new therapies, etc. I see them using big data in that manner. I also see them using big data to drive efficiencies in companies. But more importantly, as a validation engineer, I look at the use of big data and I kind of map that question onto how do we validate these types of systems, and how do we go about strategizing our validation strategies to address them, especially when a lot of these systems are cloud-based and that kind of thing. I think there's a lot of retooling, if you will, or rethinking, not only at the regulatory level, but also at the corporate level. Something that John said that I wanted to hone in on was the focus of companies and the fact that the incentives are not there. One of the things that I think has to happen is that those incentives will have to be there, and businesses respond to profitability. They respond to things that, drive the efficiencies in their business, make them more competitive, and that kind of thing. That's what drives these companies.
Absolutely.
I think when you look at big data, in a generic sense, we all as technology practitioners believe in the vision and that kind of thing. But I'll, refer you back to what we were talking about in the 90s, where we talked about paperless validation. Well, it still hasn't really materialized yet. People are using maybe a little less paper, but validation is still conducted, and people are using technology to primarily print paper. So it's kind of the same thing with big data. Big data and the vision of big data, as it's articulated by guys like Microsoft and Oracle and all of these guys, it has much promise. But like John said, and I completely agree with his statement, until these companies are incentivized to take advantage of them and see the benefits in their own companies, see the competitive advantage, I think big data, if you will, it will struggle a little bit until it gains a foothold there.
Sure. And John, I'm going to hop over to you with that same question. But because you mentioned it a little bit, mentioned it in your previous comments a little bit, just where did some of those incentives come from? So you mentioned incentivizing, but where do you see those incentives coming from, and how do you see them taking shape?
I tend to be a little negative here because of my own experience with,
That's okay.
Company management. I've seen very few individuals thinking beyond their own narrow financial incentives for the company and for themselves. The few that I do see that think ahead, look at the big picture, strategize. I see advantages to them, but I don't see other companies interpreting the advantages. I've seen smaller companies where the CEO was better at regulatory aspects than their regulatory director, and was able to position the company because it was it adhered to all the requirements of the regulations, was able to position that company for a buyout that was more profitable than it would have been otherwise, because VCs and other sources of capital, they're smart. They know what the regulatory downfall is. They know what they do due diligence. They make sure that a company they're going to buy doesn't have a bunch of skeletons in the closet that could wipe them out when they invest in it. Right. But sometimes these CEOs don't appreciate that. I don't have an answer to that. Possibly.
Yeah, no, this is just about sharing our thoughts and opinions, not right or wrong answers, but yeah.
Well, in view of what's happening with COVID, I'm sure this is going to cause a lot of rethinking among senior level individuals, and maybe some of that may open up the thoughts toward the areas that we're saying they need to look at in order to be successful in the future.
Right. I would agree. Siegfried, your thoughts on that same topic?
Well, what I see, especially in the larger pharma, is that they have chief information officers. And this is not IT. This is about data. This is about data management. This is about data handling and data gathering, and including big data. And perhaps COVID has shown many companies how they are not really set up for big data or for lots of data flows. Now that staff isn't in the office, where there's a good network, where there's good connection, but people are decentralized. And this makes it important not just to understand what data you want to gather and then to use, but also how you handle it through the networks.
Sure, absolutely. And Valarie, I want to see now, thinking from your validation perspective, do you think there's room for disruption in the industry? And if so, what does that look like from your perspective?
Yes, there's much room for disruption. Let me talk about validation itself, and then I'll expand that out into, pharma and life sciences. Sure. In validation, I think the disruption is going to come about in the form of disrupting a standard paper-based process that doesn't include cloud or mobile technologies into a more automated process using artificial intelligence, using more automated ways to conduct validation. I had a demo recently where a company actually shared with me a paradigm shift of how we validate systems. So today, a validation engineer may show up and they get a software application XYZ, and they go ahead and they write test scripts for the application and then they execute them. That's the way we've been doing it for years.
Right.
This application goes out and learns the software based on how the software has previously been used. And it brings back the test cases. This is a complete paradigm shift and a reversal of the way we execute test cases. And this is through an artificial intelligence engine. So there is much room for disruption like that. Even the agency right now is talking about something that they're calling software assurance. Software assurance takes validation and kind of spins it around a little bit.
Right.
It really focuses more on the testing and the rigor of the testing versus the actual documentation that you're preparing. You still have to do and go through some of the same motions, but what the agency is saying with software assurance is they're saying, we as the agency are not so much focused on the pounds of documents that you produce. We want to see that you're rigorously testing applications. So from a validation perspective, that's the disruption that I see. And now when we get to mobile technologies and cloud technologies, I'm even experiencing that in my practice, where we are actually disrupting the industry with the way we're going about testing. When you look at life sciences in general, there are many factors, COVID being one of them, that is actually disrupting the industry right now. One of the things that I've experienced since March of this year, many of my clients are actually changing their business model to address the pandemic. This gets again to what John was talking about the incentive of these companies to do what they're doing. A lot of companies that I'm encountering this year are highly incentivized to get in on the, COVID, either therapy, PPEs, and all of that. So I think the disruption in the industry is coming from macroeconomic forces that are forcing the industry to look at what they're doing, look at their supply chains, look at how they've been managing themselves, look at even the products that they're delivering, and really change kind of the way things are going on. Finally, I think the economics of this is really driving disruption. As companies look and, right now we're seeing, 20 million, 30 million, I don't know what the exact number is, right, Americans that are unemployed at the moment. I think companies are looking for a way to keep themselves resilient. Small, medium, and large companies are looking for that. And they're looking for ways in which they can capitalize on the economic forces that have fallen upon the entire world, not just the United States.
Right. I mean, the pandemic certainly has created that sense of urgency, right? And it's forcing everybody to think differently, think outside of the box. So perhaps it's going to take a catalyst, hopefully not to this magnitude, but to get the industry moving at a quicker pace. John, what are your thoughts on that?
Well, I noticed Valarie was talking about validation and some leading edge things, and that the agencies and behind some of that brings up another problem. The agency at the center levels are forward thinking in most cases. They all also are concerned about the profitability of the industries they regulate, not just the regulatory burden upon them. At least they've stated that, and I've seen that at the centers. But it loses translation when it goes down to the districts and the various regional posts and the people in the field that have been in the field for 10 or so years. and they've stated that. The centers have actually stated that when they want to see something happen at the center level and to be translated to the field level by their consumer safety officers, it doesn't happen. Mm-hmm. There's a lot of inertia. Change is opposed. The old way of doing things is the comfortable way.
Right.
Going from bottoms up to top down inspection took many, many years to get translated to the field among many inspectors. And so this is becoming a problem when the centers are looking at the leading edge, for example, maybe minimizing some of the degree of documentation involved with a software validation. The field is still, the inspectors in the field are still going by the pound. They're still looking at the stack of documentation, the paper documentation, etc. I've seen that in some of the inspections held not only in the U.S., but the U.S. FDA inspections held in Europe and in Asia. The tendency is still to adhere to the old way. And some of it may be justified, because when you make changes, there's always the potential of something happening in that change that may cause a safety issue to come up. I'm a little concerned, too, about the recent politicization of the FDA regarding that malaria drug a few months ago.
Hydrochloroquine.
We were talking about some of the phase 3 trials and that are going on now, and the tendency by some in politics to want to expedite that before the election, irrespective of safety issues regarding the population. And remember, a phase 3 trial with 30,000 people, only 15,000 people have actually had the actual vaccine. The others have used a placebo. So you have these issues, and expanding it out into senior citizen, something I'm interested in, population, is further issues. So the agency is under all kinds of pressure from different sides, and the fear of what the agency can or will do to a company hampers the company's ability to proceed into some of these areas that they feel could be beneficial to them in the short term, at least in my opinion.
So do you feel that then the change needs to come, from the agencies, from the regulatory agencies, and when their expectations change and their practices change, that's going to force companies to rethink the way that they're doing things?
I'd rather see both parties involved. I know the agency has talked about whenever a company is looking at something leading edge, to get the FDA involved early on in that.
Early, right.
And yet the companies are not willing to do that for several reasons. One, they don't want their intellectual property compromised, and there's a potential for that. It happened a few decades ago. They're concerned about us against them mentality.
Right.
All these things come into play because we're dealing with people. And
sure.
So the need has to be, though, that both companies, industry, and the FDA have to work together with this, and then make sure that the middle level and lower level implementers of that decision are also wired into it and buy into the program. Anytime you're dealing with a bureaucracy, and whether it's the FDA or whether it's a corporate environment, you're dealing with a resistance to change and a fear that change is going to usually impact a person negatively. And so they're going to fight against it, whether it be an inspector or whether it be a man in ranks or woman in ranks in a corporate environment. So those are the kind of issues you're dealing with. And
they're the human issues, right? Because we've had that forever. We all are territorial by nature, and we fear change because a lot of times we don't feel like we can control it. So I think you're definitely right that is a big factor in the industry. Siegfried, I want to get your thoughts too on disruption in the industry, and what does that look like from your perspective?
Well, I think the best example is an advert that shows almost daily on our television. And it is from Cancer Research UK, which is one of the largest research bodies that we have in this country. And they're saying that their research is seriously disrupted because of the COVID situation. And the disruption comes from political interference, as we already heard from my colleagues here on this call, where the researchers are directed to work on COVID medication rather than on cancer medication.
Sure.
So it's not necessarily the industry that is always in charge as to where they can go. And of course, if I'm a cancer patient and not a COVID patient, I'd be terribly disappointed with this. Mm-hmm. So there is, as was said before, the disruption from all sorts of reasons, but the political interference is not necessarily a good one. And I mean, when we look realistically at the chances of finding a vaccine for COVID, there was never a vaccine found for SARS, and that is nearly 10 years ago that this was discovered. Mm-hmm. So perhaps there is one, perhaps there is not. But to abandon all else for the benefit of one disease, I don't think is the right thing to do.
Interesting, right? And yet, worldwide, I think we're all hanging our hats on the hope that they will find something. So I feel like it might be a little bit fueled from the public too, in the sense that our expectation is they will find something and they will find it sooner rather than later, so we can, continue to move on with our lives. So it's a bit of a double-edged sword there, it seems. At this point in time, so we've talked a lot about technologies, and we've talked, about how the industry is slow to adopt technologies in certain instances. And I think we all tend to think of, we as in the public, tend to think of technology as being a good thing. But I'm going to pose this question to the three of you. At this point in time, do you see technology as a threat or as an opportunity? And, and is technology and creativity, are they at odds with each other in this industry? Or can we work together to produce, a greater result? I'm going to let you kick us off with that one, John.
Wow. Okay.
Wow, right? So, but it's important. Like, I think about that as I listen to the three of you talk. Like, is this really an opportunity, or is it more of a threat?
I don't view it as a threat. There may be individuals that do within a corporate environment. It depends on the individual and their background. One of your pre-questions you mentioned was the opportunities for young people and what they should be focusing on. Kind of related to your question right now, I would say that if an individual is looking at technology versus the other issues that they're facing, and they hope to not be a technologist all their life, like a scientist. There are individuals that want to do that all their life, and that's fine. We need those individuals. Yes. There are other individuals that are looking to the corporate ladder, so to speak, or whatever, driving a company. Those that are interested in driving a company or seeking a more generalized management role, I think would be best off being less technical, having some technical background. I feel that they ought to know basic computer skills, basic statistics, basic how to write a letter, how to write a memo, how to record information that's coherent. I see engineers that can't do that. And I can't understand what they're writing in their lab books without explanation. And sometimes they can't 3 months later when they look at what they wrote in the past. These are the kind of things that if an individual wants to be technologist, they need to pursue that pathway, and the company needs to reward that pathway. And an individual wants to be a little bit of a more generalist, guiding the company in some of its general principles, then that person should be more of a generalist with some technical background. They ought to be able to read a CAD drawing, for example. They don't have to be a CAD expert, don't have to generate the drawing, but ought to be able to read a CAD drawing. They ought to be able to explain basic statistics to their team. Not be a biostatistician, but just basic industrial statistics.
Yeah. I think that's interesting, John, because as we have become more technologically savvy as a population, I think we have had the expectation that people are going to focus in more on a specific area of expertise. But it sounds like you're saying we need to step back maybe, or at least some people do, and be more of a generalist, return to that more of a generalist role.
I can base it on my own personal experience in industry. I'm not a degreed engineer, but I had a lot of pre-engineering courses. I followed the advice I was just giving myself, and I found that I was able to get projects out the door faster than degreed engineers because I examined the whole picture in the company as to what it took to get a product from A to B to Z, through the regulatory process, through the financial process, through the marketing process, not just the engineering process. And as a result of that, I feel even engineers, if they even want to remain just an engineer, and that's an important function within a company, even a senior engineer,
absolutely,
that they need to have these other skills, these people skills, team skills, writing skills, communication skills, presentation skills, PowerPoint skills, whatever you want to use, spreadsheet skills, basic understanding of fields outside their own narrow sphere of engineering, maybe computer skills if they aren't in computer engineering, etc., to be effective even in their technological job area.
Interesting.
But a person that's seeking to move up in the company to guide the company and its overall goals needs to be more well-rounded.
Right, right. Siegfried, what do you think about technology? Is it more of a threat or an opportunity? And are creativity and technology sort of at odds with each other here in this industry?
Oh, I see technology as an enabler. It helps us to be more creative, to do more. If I think back what we could do with a typewriter compared to what we can do with a word processor, of course we can do more. We can do much better graphics these days than when we had to draw it by hand with a pencil. So yes, technology is a great enabler. The concern I have is that especially the younger generation loses their social skills. John was already mentioning some of them. And you see, once you can stand together at a blackboard or whiteboard and you have a team throwing out ideas, coming up with new models and so on, you cannot do that via a meeting like this, via computers. You have to have social interactive skills, working together, developing things together. And no technology will help you do this. You need to have these face-to-face events where you need to come together. So when I see these youngsters not being able to write a comprehensive sentence or comprehensible sentence, then this fills me with fear. So we need to have the right balance between using technology and developing social skills.
Absolutely. I 100% agree. Valarie, I'm going to let you wrap us up on this particular topic.
Absolutely. Yeah, I agree strongly with Siegfried that the technology is an enabler. If you look at our economy today, it has really allowed many businesses, such as mine, to actually thrive as we've gone online with a lot of technology that has enabled us to still conduct business the way we did. I am a degreed engineer, and during my engineering curriculum, one of the things that the University of Wisconsin made us do at the time, and I graduated in 1982, so this was many moons ago, but I thought it was very forward thinking. They made us take a technical writing class. And both John and Siegfried have said that many engineers cannot write. The university actually recognized that. And I can tell you now that still to this day, I use the principles and techniques that they taught me in my technical writing class as I'm writing for validation. I strongly believe in what Siegfried was saying about young people and the fact that when I interview people for jobs at OnShore Technology Group, one of the first things I do is ask for a sample of their writing, because I need to see how well they can clearly articulate technical concepts. When I got my MBA, one of the things that we had to do for our MBA is to present a business plan before a group of executives. This was part of what we had to do, to graduate with an MBA. And it was interesting because even in that curriculum, there was a technical writing class that they had where you have to explain technical subjects to executives. And that's more than a notion, because executives sometimes have very short attention spans and they want you to get to the point. Right. And that was something that as an engineer, I wasn't used to doing. Engineers, we always want to explain the whole bloody thing and, get through, 90, paragraphs of something. When you get before an executive, you don't have the luxury of being able to do that. Yeah. So in both of my curriculum, both on the undergraduate level and at the graduate school level, I had training classes that basically honed in on, technical writing and communication of technical subjects. These are things that young people need to be involved in. I am involved in STEM programs at the National Science Foundation and at the university level. I work with the University of Wisconsin in Madison, teaching young people about STEM concepts and STEM technologies and encouraging them to go into STEM. It's a big deal for me that we speak to young people about our profession, about what it is that we do. I'm on a website that's sponsored by the National Science Foundation called Girls in Engineering. And it basically talks about day in the life of a female engineer and how engineers are, basically working in the industry right now. And even though I did practice civil engineering for 13 and a half years, and I worked on CAD systems. I worked for Intergraph Corporation doing computer-aided design and drafting, mostly for site engineering, geotechnical engineering, and transportation design. But when you look at what kids are going into now, I always tell, and I say this to my own children, look at the economy right now. What two industries are booming at the moment? Technology and life sciences and healthcare are booming at the moment. Anything STEM is booming right at the moment. So we have got to, and this gets again, and I feel very strongly about this, this gets to our nation's national strategy and getting someone in politics at all levels who emphasizes education as a national security strategy. It is absolutely imperative that our young people today focus in on the things that took us to the moon in the 60s and things of that sort. Right. We were technical innovators. We still are. We need to encourage our young people to participate in those areas.
Excellent. Thank you. So so the takeaway here is that, the technologies are coming, but we need to remember that, the skills we learned in school, or hopefully the kids are still learning, need to be an equally important part of what we're doing in the industry. Right.
Absolutely.
Thank you. So as we think about moving forward, as an industry, Siegfried, I'm going to let you kick us off with your thoughts on trends that you see emerging in this sector in the coming months or years. In the coming months, I think we're going to still be focused on COVID, but maybe post-COVID. What are your thoughts?
Well, I see a clear trend from industry and the regulators to get back to some level of prior normal. That means that although inspections or audits were performed from remote, they are not the same as when you're there in person. Mm-hmm. And factories, they try to get up and running again, to have their staff back in the factory. And we see this happening like a wave coming from the east, because if you look at places like Korea, so they're operating almost like normal again.
Yeah.
So there is, and I'm personally actually looking forward to flying again. I love flying, so I want to do my thing for the airline industry.
Right.
But I mean, seriously, we need to get back to some level of normality, because without the industry isn't set out yet for automated manufacture. We still need personnel on site, and this is where I see things going.
Thank you. Valarie, I'm going to ask you the same question. What do you see emerging in this sector in the coming months or years?
I see more of a use of artificial intelligence, robotics. I see more innovation around distancing and learning. Training is a big issue within our industry. The GMPs or GXPs say that you have to be trained for everything. Even OnShore is building a virtual training academy for what we're doing. I see more virtualization going on, virtual offices, virtual training, virtual communication as we attempt to social distance in the middle of the pandemic. I see that a lot of this is changing, but it's kind of things change, but they always still remain the same. I think we're still going to be doing things a lot like we're doing them today. Right. But I think that, the changes that are going to take place, which will require advanced technology at the end of the day to facilitate, I see more of that coming in the future. But I do see more of an emphasis on the acceleration of big data. I see more, and this is what I'm seeing in my practice. Many of the companies that are coming to us are updating their supply chain and automating their supply chain using enterprise resource planning technology, MRP, manufacturing planning resource technology, and so forth. I see a lot of companies doing that right now in preparation for the future economy.
Yeah, I'm very happy to hear that. I mean, I think that we do need to embrace these technologies. And so if you're starting to see that, that's encouraging.
Absolutely. Absolutely.
John, your thoughts on trends emerging, whether it's in the medical device or the life science industry at large, your thoughts on the coming years and months and years?
Well, I have to emphasize what has already been said by Siegfried and Valarie, the fact that AI and robotics, they're here. 3D printing is here. Companies are going to be slow to implement them to the degree they really could, and that's to be expected to some degree, but it is the trend. People that are entering the industry should be conversant in these technologies and be part of the solution as opposed to holding back on that. Areas too, counterfeiting of product. That's a big issue with drugs. The U.S. has a lot of, each state has drug pedigree requirements, blockchain, computerization, such as IBM and others offer, may pose a solution for that kind of supply chain potential disruption. I expect to see more of that, especially if we maintain the long distance supply chains like between the US and China and India. That's been an issue recently coming up with the contamination of APIs and things like that, either from naturally occurring reactions in the storage of product or intentionally or unintentionally using contaminated product in the first place, or the introduction of counterfeit ingredients into a supply chain, whether it be device or pharmaceuticals. So I see blockchain as being a short-term area, but I see in my experience in the industry, manufacturing has gradually embraced mechanization. That's working toward AI and robotics, but it's a slow process. companies do not automatically replace a system that is least profitable by a multi-million-dollar shift that requires not only the implementation of the equipment, but also the support staff necessary to run and maintain that equipment. And then the issues regarding the regulatory concerns. Sometimes the regulatory functions within a corporate environment can be just as obstructionist as a fear of a outside regulatory agency like the FDA. I see QC and RA in some companies, QA and RA, holding a police function and a don't do it this way, do it the way I say, bureaucratic way, which stifles some of the other when they didn't have to do that. They try to protect the company by adding additional restraints that they don't have to per the regulations in order to so-called keep the company from getting into an area where they'll get into regulatory trouble. So that gets back to this issue between corporations and regulatory agencies talking more with one another, especially with the U.S. and FDA and corporate environment in the U.S. Out overseas, you're kind of more of a partner with your certified body, notified body, but although that's changing now with the MDR. But in the United States, it's a us against them mentality that still exists that really should be trying to be broken down without compromising safety and efficacy.
Right. Well, I thank you for that. We have covered so much today in this discussion, and I think it's food for thought for people in the industry, but also folks outside of the industry. So I really appreciate your time. I'm gonna wrap us up today because we've spent a long time talking about such important topics. But as we do that, I just want to quickly allow each of you to talk about which technology or trend, since we've talked about that, are you most excited about in the coming months? And Siegfried, we'll hop back over to you.
Well, it's really difficult. I gave it some thought, and I can't really pick out one particular technology or so. But what we're doing just now, this video conferencing, when I look at this has come an awful long way compared with just maybe 2 or 3 years ago, when you always had to come to a particular office space where there were the cameras set up, and being able to conference like this easily, I think is already one of the great technology advancements that we have seen.
Excellent. So yeah, I agree, and I think we've made even better use of it because of the pandemic. We've sort of been forced into it, everyone globally, and it's working. So that's good. Valarie?
Yes, I am most excited about automated testing and artificial intelligence. In my practice, we have a validation center of excellence in Chicago. And one of the things that we do is we experiment with different technologies applied to the validation of other technologies. So we have cloud applications, mobile applications. We look at process validation and look at different ways to validate. I am most excited and most focused on the streamlining of validation. At OnShore, we have something that we call lean validation, which really takes the principles and best practices of lean manufacturing and applies them to the validation process to eliminate waste and inefficiencies. And one of the reasons why I'm so excited about the automated testing is that one of the key things that has been kind of the holy grail, if you will, of validation is to streamline the process to do more with less. Right. To rigorously test applications without having to go through the mountains and mountains and mountains of manual effort, going through there, tracing test scripts manually and all of these types of things. I'm more excited about what this technology can do to the practice of validation. It doesn't mean that validation engineers can just sit back and let the technology do its job, but it does mean that companies will be able to adopt advanced technologies faster by automating the validation process. It does mean that validation teams can do more with less. And as these technologies advance, I'm really excited about the potential that it could bring to businesses.
That is exciting. Thank you, Valarie. And John, we'll let you wrap us up. What technology or trend are you most excited about?
I agonized over that, and I kind of go back to what Siegfried just said. Although each industry has to look at technology as how they can implement it and what benefits it would provide to them.
Right.
The bottom line is communication. The bottom line, even with technology, is communication. Steve Jobs was a very effective communicator. He told stories to drive home what was to be accomplished. He may have had his idiosyncrasies and others, but he was very effective in communicating a vision. And that's what I think is key, not just at the C-suite level, but at every level. For example, when I used to work for a company in Salt Lake City, we'd have a marketing meeting in Chicago. We'd fly out in the morning, have a 1 or 2 hour meeting in Chicago, and fly back another 6 hours to Salt Lake City. It's ridiculous. We can do it now.
Right.
I know when I was in a corporate environment, I'd never use the phone if I could avoid it. I wanted to see people's body language and facial expressions when I talk to them. And something like this is the next best thing.
Right.
Zoom or Skype or the WebEx or whatever. To me, whatever facilitates effective communication where you can understand where somebody else is coming from, beyond just the verbal, but the actual what's behind the verbal in order to get a common ground, to me, is a key of even being successful with the technology.
I agree. And I love that all three of you have talked about the importance of technology with the human touch, right? We still need the communications. We still need to be able to interact with each other and bounce those ideas off, and use all of that knowledge that we're able to garner from each other to better leverage the technologies. So that's a great way to wrap us up, John. Thank you so much, Siegfried, Valarie, and John. It's been amazing having this discussion with you today, and I really appreciate you taking so much time. I also want to give a big shout out to our producer, Ben Kitchen, in the Studio 21 Podcast Cafe. Lastly, a big thank you to you guys, our listeners. We value you so much. If you have topic requests or guest suggestions, we'd love to hear from you. If you enjoyed this episode, we ask you to subscribe in your podcast player of choice, and don't forget to share it with your friends, colleagues, and online networks. We appreciate that. For today's show notes and information on the podcast, please visit www.ivtnetwork.com. We'll be back again next week with another great interview. Until then, stay healthy and safe.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Cafe, the United Podcast Network, its partners, or affiliates.